Hi, my name's Ann Haber, and today we are going to demonstrate the anatomy of the lymphatic system. So remember, the teeniest, tiniest of blood vessels are called capillaries, and the teeniest, tiniest of lymphatic vessels are called lymphatic capillaries. The lymphatic capillaries are picking up fluid from the interstitial space, and that fluid is called lymph. The lymph is traveling through the lymphatic capillaries, which will ultimately empty into these larger vessels called lymphatic collecting vessels. They look kind of like veins, and they do travel the pathway, same pathway of veins, but they're carrying lymph, not blood. And that lymph eventually will pass through a series of lymph nodes. Okay, and we have lymph nodes located throughout the body, and we name those lymph nodes after the body regions they are in. For example, these would be called inguinal lymph nodes. These would be called axillary lymph nodes. These would be called cervical lymph nodes. These would be called periaortic lymph nodes, and so on. Okay, so the lymph is actually traveling superiorly, and it is ultimately going to empty into two lymphatic ducts. And those ducts will empty that lymph back into the venous circulation at the subclavian veins on both the right and left side. So this is an enlargement of the lymphatic system in the thoracic and some of the abdominal region. Now, those lymphatic collecting vessels that we talked about actually empty into larger lymphatic vessels that are called lymphatic trunks. And they're not always easy to identify, but we have lymphatic trunks from the lower body, and we have lymphatic trunks from the upper body. So I'm just going to state their names. Their names are telling you where that lymph is coming from. For example, we have the right and left jugular trunks. We have right and left subclavian trunks. We have right and left bronchomediastinal trunks. And on the lower part of the body, we have right and left lumbar trunks and also an intestinal trunk. From the lower body, those lumbar trunks and intestinal trunk empty into this kind of large pocket here that is called the cisterna chyli. And the cisterna chyli gives rise to this, what looks like a lymphatic vessel but is not. That is actually one of the lymphatic ducts. Okay, so this one is called the thoracic duct, and it starts at the cisterna chyli, and it ascends through the thoracic cavity, goes up, 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 circles around behind the jugular vein, and then empties into the venous system right at the junction of the left jugular and left subclavian veins. So it's right here as it empties into the venous system. That's the thoracic duct, and it's pretty long. Starts at cisterna chyli, ends up dumping in between the jugular and subclavian veins. That's the thoracic duct. The right lymphatic duct is not long at all. Okay, so the right lymphatic duct is just this little piece right here. It's receiving blood from jugular subclavian. It's not receiving blood. It's receiving lymph from jugular, subclavian, bronchomediastinal trunks, and then just this little piece right here is the right lymphatic duct. This is an enlargement of one of those lymph nodes that we pointed out. Remember that the lymph nodes, they are considered a lymphatic organ. Okay, and they have lymphatic vessels emptying into them, and they have lymphatic vessels leaving them. And inside the lymph nodes, we have part of our surveillance system of the lymphatic system, and that includes B cells and T cells. So within the lymph nodes, we have these structures called lymphoid follicles, and they contain lymphocytes, B cells and T cells, mostly B cells here. The T cells are in different places in the lymph node. What we can do then is we can expose the lymphocytes to lymph that is passing through the lymph node. And of course, that can activate the lymphocytes that live in those lymph nodes. Notice that the lymphatic vessels have valves similar to the veins, okay? They are also made of smooth muscle. And so lymph is propelled through lymphatic vessels in a similar fashion that blood is propelled through veins. We use muscular pumps and we use respiratory pumps to squeeze on these vessels. Their smooth muscle is a little more efficient at squeezing and propelling lymph than veins are. But here goes the lymph through that valve. So the system of valves ensures that the lymph only goes in one direction. Okay, and these lymphatic vessels are going into the lymph node, so we would refer to them as afferent lymphatic vessels, and these are leaving the lymph nodes. Sorry, I misspoke. This is an afferent vessel going towards the lymph node, and this is an efferent vessel going away from the lymph node. So we just finished talking about lymph nodes as lymphoid organs. Okay, so they are considered lymphoid or lymphatic organs. And we have other lymphatic organs as well. The thymus the thymus here and here is located in the mediastinum, and it surrounds the pulmonary arteries and part of the aorta. Okay, it is inferior to the thyroid gland. So don't get your thymus confused with your thyroid gland. Okay, and the thymus is evident in babies and children and adolescents. This happens to be the thymus of an adolescent. But if we were trying to find a thymus in an adult, we probably would not see it being this prominent. It atrophies as the individual gets older. Another lymphoid organ that we can see in this image is the spleen, which is here. The spleen is in the left upper quadrant, just lateral to the greater curvature of the stomach. And it is a lymphoid organ that will filter blood-borne pathogens and help to create immune response against the blood-borne pathogens. Other lymphoid organs include the tonsils. So we have a nice view of the tonsils as a physician would look when he has you open your mouth and say, ah. We have the palatine tonsils here. And remember, they are lateral to the soft palate, okay? And then we also have the pharyngeal tonsils and the lingual tonsils. Very hard to see on this image, but the lingual tonsils are on the posterior aspect of the tongue. So once again, these are the palatine tonsils, lateral to the soft palate, the palatine tonsils. The lingual tonsils are on the posterior aspect of the tongue, and the pharyngeal tonsils, also known as the adenoids, are in the posterior aspect of the nasopharynx. So we've discussed the lymphatic capillaries, the lymphatic vessels, the lymphatic trunks, the lymphatic ducts, and the organs of the lymphatic system.